Hello everyone. In this video we'll be seeing the general examination, and before starting this general examination I would like to tell you that I've personally seen a lot of difference between different teachers, and some of them they add something and others they do not want something in this general examination. So in this you might have to add something or you might have to remove something later on, but this is surely going to be of great help to you. So let's start. Before starting the general examination, we need to take a proper consent, and in case of female patient, we need to have a female attendant with us, and there should be adequate light. Then we assess the level of consciousness. Are they cooperative? Are they well oriented to person, place and time? And normally they are conscious, cooperative and well oriented to person, place and time. So we can just try to remember this normal situation, and we can say this in a single sentence, something like this: the patient was examined with a proper consent in presence of a female attendant in adequate light. He is conscious, cooperative and well oriented to person, place and time. Then we say about the general condition of the patient. Are they having some IV cannula or urinary catheter or some kind of drainage pipe coming out from their abdomen or somewhere else? Then coming to how they look. Do they look calm, sick, cachexic or emaciated, which is the case with cancer patients? Then their gait, which means how they walk, and if there is no abnormality in their walking, we say the gait is normal. Then their build. Build is actually the measure of the skeletal framework of the body, which means the bony structures, and build can be average, tall. We generally say the build is average. Then coming to their nutrition, are they adequately nourished or they are undernourished or obese? Then we have to calculate the BMI, the body mass index. It is weight in kilogram upon height in meter square. Then how their face looks. Does it looks normal or they have a face which is characteristic of a disease, like a mask face in case of Parkinsonism or a moon face in case of Cushing syndrome or something else? Then their skin, is it adequately hydrated or dry, or does it have any macule, papule or vesicles? Then the condition of their hair and nails. We generally say for a normal patient the hair is lustrous and the nails are hygienic or normal. The oral cavity, is it hygienic or unhygienic? Then we have to mention the vitals of the patient, their temperature in Fahrenheit, and we have to specify where we have measured the temperature. Have we measured it in the oral cavity, in the axilla or in the rectum? Then we have to tell about the pulse, the rate of the pulse, and where we have measured the pulse, and the rhythm of the pulse. Is it regular or is it irregular? And if it is irregular, then we have to tell about the irregularity. Is it regularly irregular or irregularly irregular? Then the volume, the character of the pulse, and the condition of the arterial wall where we have measured the pulse, and is there any radioradial or radiofemoral delay? Then we have to mention the blood pressure and the place where we have measured the blood pressure, and then we have to tell the respiratory rate by observing the chest movement, and we also say whether the respiration is thoraco-abdominal or abdominothoracic. And then we have to palpate all the peripheral pulses like dorsalis pedis, popliteal, femoral, and maybe carotid, and then we have to specify whether all the peripheral pulses are palpable or not. Then we have to measure the JVP, the jugular venous pressure, and we have to specify whether it is raised or not raised. We can also mention this JVP in centimeters, and we have to tell about the waveform, whether it is normal or not normal. Normally the JVP has a normal X descent and a normal Y descent. Then next we have something which we can remember as pickle, the pallor, icterus, cyanosis, clubbing, koilonychia, lymphadenopathy and edema. We have to inquire whether these are present or not present. We have a grading system for clubbing, and we also have a grading system for pallor. For pallor we look at the lower palpebral conjunctiva. For icterus we look at the sclera, preferably on the temporal side. In cyanosis, we have central and peripheral cyanosis. For peripheral cyanosis, we look at the tip of nose, nail bed, skin of palms and soles. For central cyanosis, we look at the tongue. Now, koilonychia means spoon-shaped nails, and for lymphadenopathy, we look at the cervical area. This is the area of the neck. Now, there are many places to look for edema. We start from below. We press behind the medial malleolus, then we press at the shin of the tibia. We can press at the sacrum. Then we have to look for any engorged or dilated veins in the neck. We have to check if there is any thyroid swelling or not. And sometimes performance scale is also mentioned in the general examination. Now I'm going to read out the general examination as if I'm presenting a case. The patient was examined with proper consent in presence of a female attendant in adequate light. He is conscious, cooperative and well oriented to person, place and time. He has a IV cannula in his right hand. He looks calm. Gait is normal. Build is average. Nutrition is adequate. BMI is 22 kg per meter square. Face looks normal. Skin is hydrated. Hairs are lustrous. Nails are normal. Oral cavity is hygienic. Temperature is 98 °F measured in the oral cavity. Pulse rate is 80 beats per minute measured in the radial artery. Rhythm is regular. Volume and character are normal. There is no arterial wall thickening and no radioradial or radiofemoral delay. Blood pressure is 122 by 84 millimeters of mercury measured in the left brachial artery in sitting position at 45 degree. Respiratory rate is 16 per minute and it is thoracoabdominal. JVP is not raised and have normal waveform with normal X and Y descent. Icterus is present. Pallor, cyanosis, clubbing, koilonychia, lymphadenopathy and edema are absent. There are no engorged neck veins and no thyroid swelling. Do give me a thumbs up, and if you have any questions, suggestions or feedback, leave them in the comment section. Subscribe to the channel and share this video.